I've never taught my students anything. I just try to put them in the best conditions to learn. Albert Einstein. Diapath is based in Italy, near Milan, with a network all over the world. Diapath is a leading company offering a complete range of innovative instruments, reagents and consumables for anatomic pathology. Diapath Knowledge Academy offers educational webinars dedicated to lab scientists, anatomic pathology professionals, anatomopathologists and students. We are glad to introduce you our teacher, Dr. Antonella Savio. Dr. Antonella Savio has been working as a histopathologist for over 30 years in 5 different hospitals in Italy and UK. Thank you very much for the precious cooperation. Before starting the webinar, just a few practical information. The webinar is about 30 minutes. Then we are going to have a question and answer session at the very end of the webinar. So you are kindly invited to have your questions at the very end, typing the questions in the chat for the final open discussion. Thank you. Now let's start with the webinar. Safety in histopathology. Patient, staff and environment.
To introduce today's topic, the safety in histopathology, let's go back to this slide from our second webinar, The Journey Towards Quality in Histopathology. It is important to stress that quality does not only involve the technical process from the point of view of instruments, reagents, quantities in protocols, internal and external quality controls, and from the more difficult to be assessed point of view of interpretation of results and their evaluation in the context of knowledge. Safety assurance is also an integral part of quality in histopathology, which is at risk in the absence of it. Safety includes safety for the patient. In fact, to be effective and safe, all the procedures and activities should be evaluated and monitored accurately. The safety of all staff and the environment is also highly important. Safety is defined as freedom from accident injury, and healthcare systems should be safer at all levels to prevent errors. Safety in a surgical pathology laboratory should be a priority for all managers. Enrolling in a safety program should be done, and this process should begin with the recognition and understanding of the hazards, followed by the implementation of safety measures. Risk management pertains not just to personal health and safety, but also to environmental health and safety. Deficiencies have been frequently reported by the personnel in the knowledge, attitudes and practice of laboratory safety in many cases. There are 3 different categories of risk in histopathology laboratory: biological, physical and chemical. The most obvious source of biological risk is with fresh tissue and body fluids. Grossing carries the highest risk of all histological activities, while fixed specimens have a much reduced risk because nearly all infectious agents are deactivated by fixation. Risks due to equipment can be minimized by proper installation, care and staff training. Mechanic injuries due to hot surfaces or cutting instruments can be avoided by adopting safety measures. Broken glass particles and disposable microton blades should be disposed of in special sharp containers. There are some general rules that have become compulsory in many countries, like having a special storage for flammable reagents. It is important not stockpiling them and avoiding exposing chemicals to heat or direct sunlight. No food or beverages should be kept in refrigerators or storage together with chemical agents or biological samples. Let's start with the risk of exposure to biological agents and related health problems for healthcare workers. Workers in the healthcare sector are at a high risk of exposure to biological agents. It is a matter of fact that occupational injuries among healthcare workers are common, although they are underreported. 10% neutral buffered formalin inactivates almost all viral particles in tissue after 1 day of fixation at temperature of 25 to 37 degrees centigrade. Like the tissue materials completely fixed in formalin, the cytological specimens fixed in alcohol 95% are not considered to pose a microbiological risk. All fresh and/or inadequately fixed surgical and cytological materials should be instead considered potentially infectious. The post-mortem theaters and histopathology laboratories where they are handled must therefore meet appropriate biosafety requirements. Infections represent the principal biological risk, primarily tuberculosis, HIV infection, hepatitis C and hepatitis B virus infections. Potential exposure sources include blood, bodily fluids, and body parts. Each source is likely to be associated with a particular type of microorganism or group of microorganisms, characterized in terms of how the microorganism is transmitted, the severity of the disease symptoms, how easily the disease is spread, whether or not there is a vaccine or post-exposure prophylaxis suitable and available, and how well the microorganisms survive in the environment. Sharp and needle-stick injuries are the main source of infections. In laboratories, not only the use of sharp instruments, but also unsafe sharps handling, the management of sharps containers, or the accidental breaking of glass slides or bottles, the mucocutaneous exposure to body fluids splashes, glass perforation from excessive wear can all be a source of infection. An increase in workload may also increase the risk of accidental exposure among workers with higher risk of exposure, more accidents and errors due to stress. Airborne exposure is a well-known risk for laboratory workers. Healthcare workers are a well-known risk group for tuberculosis, which is transmitted through the air, and in high-income countries are estimated to be twice as likely to become infected as the general population of the country, while in low and middle-income countries, healthcare workers are up to 10 times more likely to become infected with tuberculosis than the general population of the country. In addition to transmission via the air, entry via the skin due to needle-stick injury is described in the literature. Working areas with air conditioning system, high humidity or systems containing stagnant warm water are amenable to the growth of Legionella, and that healthcare workers may be at risk. A number of epidemics of legionellosis have been recorded in recent years in the hospital environment in Europe. Last but not least, it is not only the specimens that can be the source of a possible airborne infection, as recently learned by the pandemics. Both COVID-19 and flu can be transmitted at work by the workers itself. Workers in the healthcare sector are also exposed to allergenic agents that can cause asthma after inhalation of small particles of latex or powder from powdered gloves, which are present in the air after, for example, removing gloves. But cases of anaphylactic reactions as a result of dermal exposure to dust from latex gloves have also been described. Although it is not always easy to distinguish specific risk factors, workplace risk assessments need to take account of possible exposures. The extent to which healthcare workers are exposed to biological agents may vary. The exposure to a biological agent can be direct or indirect, for example during cleaning or removal of clinical waste. Although substantial information is available on the types and means of exposure in the healthcare sector, quantitative data on exposure and the associated health effects are lacking. Exposure to biological agents are not measured frequently, and there are only a few databases available that contain measurement results. Some groups of workers can be considered inherently vulnerable, the particularly sensitive risk groups, for example, aging workers, young workers, female workers. As in other sectors, in healthcare, trainees and workers in their first jobs are considered vulnerable groups because they have less practical experience and are generally less aware of the risks. Experts consider cleaners to be an important vulnerable group since they often perform tasks that may put them at risk, such as cleaning or disposing of sharp instruments, which poses a relatively high risk of injury. In addition, there may be less clarity for externally contracted cleaning services compared with internal cleaning services with regard to, for instance, who is responsible for providing information about risks and safety measures, the provision of personal protective equipment, and the vaccination of personnel. An emerging health occupational risk is any risk that is considered to be new or increasing. Emerging risks include newly created or newly identified risks, increasing risks, and risks that are becoming widely known or established. These include a number of issues, namely antibiotic-resistant microorganisms, infection through blood-borne pathogens, accidental exposure, and risks linked to globalization. Increasing international trade and changing travel patterns, as well as migration flows, are considered a huge problem because they increase the likelihood of the global spreading of diseases. As we all know, novel viruses and prions emerging in various parts of the world may pose a threat to the health and life of healthcare workers and veterinarians. Globalization has led to an increase in travel to other continents, and this, as expected, has led to pressure on health systems, and local health systems have now to deal with global health problems. Lastly, climate changes have led to a wider spread of some diseases previously not endemic in regions where these diseases were not present. Policy measures. National and international regulations set out minimum requirements for special control measures such as detailed codes of practice and guidelines for the safe handling of biological agents. Successful policy measures exist in hospitals, focusing on the protection of workers. These measures are aimed, for example, at preventing the spreading of infectious diseases such as flu through hygienic work practices and the administration of seasonal flu shots. However, healthcare workers' contribution is essential. They must be able to accurately document their exposure. Under-reporting, incomplete recall due to stressful situations, and non-compliance with protocol are all referred to as noteworthy complications. In general, the workers active in implementation of regulation and control measures are likely to be better trained and more aware of the risks they are exposed to. The measures to be adopted include risk education, information on biological risk, vaccination rules for professional caregivers, the development of protective clothing and equipment, and a national surveillance system for accident types, circumstances that prioritizes the prevention of risks. Health professionals are informed about and educated to be aware of infection risks in relation to blood-borne infections, the use of protective equipment, and the importance of vaccination to prevent infections. The vaccination of healthcare staff is common, although the percentage of personnel that is vaccinated could be higher. Campaigns focusing on vaccination and providing correct and appropriate information to the public are also recommended to prevent false information from spreading. In addition, training should be on a continuous basis, and repetition of instruction on procedures to all workers, for example using training videos, are recommended. Checklists can be very useful in the process of risk assessment. It is necessary to have biohazard containment fume hoods with adequate filtering systems and personal protective equipment. We distinguish between chemical fume hoods, which are the fume hoods most commonly available in our facilities, and biological fume hoods, which are classified according to their constructions and therefore protection characteristics. The ideal hoods are those with Class 2 B2 biosafety characteristics, which are at negative pressure with respect to the room, and all exhaust air is expelled to the outside with a duct with a HEPA filter. If you do not have a hood with these characteristics, it is in any case essential to use either a biological hood of a lower class or a chemical hood, the latter with full suction and total expulsion of the outside after HEPA filtration. The possibility of using UVC sterilization of hoods is useful. Wherever possible, sample requests should be dematerialized and should use instead an electronic order entry. For those who want to deepen their knowledge on this topic, these all are good online resources to obtain more information about the recognition and management of the biological risk. The documents of the Occupational Safety and Health Administration of the European Centre for Disease Control and Prevention are also offered in different languages. Chemical and physical hazards are part of the daily routine when working in a histopathology laboratory. If not identified and controlled, they can not only expose the laboratory workers to injuries and illnesses, but also cause damage to the lab itself and to the environment. The first step in managing risks from these chemical and physical hazards is to identify them in the workplace. Once the hazards have been recognized and evaluated, a plan needs to be laid out and implemented in order to reduce their risks. A possible source of injuries is represented by the electrical laboratory equipment, which can be dangerous when there is an increased risk for electrical shock. This can be prevented by proper installation and regular maintenance and controls. Many pieces of equipment are engineered and manufactured assuming certain parameters such as uninterrupted power supply, consistent and constant voltage, and stable ambient temperature. Technical specifications of equipment should be checked against existing conditions prior to procurement to ensure compliance. Whenever possible, installation of equipment should be done by the manufacturer and regular maintenance should be planned. Maintenance can be divided into inspection and preventative maintenance and corrective maintenance. Inspection and preventive maintenance is scheduled activities that includes inspection to verify proper functionality and safe use of a device, and preventive maintenance to extend the life of the device and prevent failure. Corrective maintenance is unscheduled activities to restore the physical integrity, safety and performance of a device after a failure. Ensuring maintenance of equipment would result in a high level of performance and greater confidence in the reliability of results, fewer interruptions of services due to breakdowns, lower repair costs, and increased safety and productivity. Efficient equipment and well-trained personnel are the keys to preventing and minimizing physical hazardous exposures. It is important to assign responsibility for performing maintenance of the equipment, develop a system for recording the use of parts and supplies, implement a written plan for calibration, performance verification, and proper operation of the equipment, establish a scheduled maintenance plan that includes daily, weekly, and monthly maintenance tasks. Provide training for all operators. Only personnel who have been trained should be authorized to use the equipment. The equipment should be plugged into outlets and not into extension cords. They should be installed away from flammable substances because the electrical equipment can set alight flammable vapors. Mechanical dangers from equipment include burns from hot surfaces and cuts from broken glass and disposable microton blades. Designated sharps containers should be used for the disposal of sharp objects. Certainly, the instruments themselves can help to increase the safety of the operators and prevent a potential physical injury. It is very important that our devices are equipped with technological protection systems and that the operator is trained to make a correct use of them. The microtome is an essential tool for pathological anatomy, but it certainly involves risks for the users. For this reason, it is important that it is equipped with an emergency button that blocks the instrument and with specific alerts that warn the operator in good time. Besides familiarity with the safety features of the microtome in use, the operator must observe some basic precautions. The blades are very sharp and should be used with due care. Never use of fingers to pick up sections or fragments of paraffin in proximity of the blade. Use forceps or a paintbrush instead. Rotary microtomes should be equipped with blade safety protections to remove the blade without contact with the operator and with an electronic flywheel lock. A correct use of the blades is also important. The use of blades involves a number of expedients, such as using the blade from one end to the other, thus ensuring maximum durability for each portion of the blade. Use one part of the blade for grossing and another part to obtain the final sections. Alternatively, two different blades can be used for the two procedures. A microtome with active retraction of the block prolongs the life of blades by removing the sample from the blade during the upstroke and preventing the build-up of residue on the back face of the blade. During all these steps, operator's attention is crucial. Ergonomics is a science that describes the interaction between human beings and machines in the working environment. Dangers include repetitive movements, exposure of the vulnerable back to sudden excessive forces, and inappropriate working postures. Mechanical risks can lead to a variety of musculoskeletal disorders, including tendonitis, tenosynovitis, carpal tunnel syndrome, and other nerve disorders. Automation should be considered to cover manual tasks for more standardization and to decrease the risks of musculoskeletal disorders. Laboratory workstations should be modular and flexible so that they can be altered to accommodate new tasks, equipment, or people. All the recommendations reported in this list are applicable to a broad range of processes, including labeling slides and cassettes, replacing the solutions on the processor, embedding paraffin blocks, microtomy, manual staining, and cover slipping. In addition to these, there are special recommendations for the posture, height of chair, level of the monitor, position of the screen when using computers, and additional instructions on the better ergonomics when using the microscopes. I'm not going into more details with this topic. A wide range of chemicals potentially dangerous are employed in a histopathology laboratory. However, employees often do not perceive of being exposed to hazardous chemicals. Having an adequate knowledge of the properties of these substances, of the protective equipment and preventive measures available is very important. Chemical hazards can be classified into different categories based on their associated health hazards. The examples given here show that the variety of reagents used in a histology laboratory represent all sorts of hazardous chemicals. Irritants cause reversible inflammatory effects at the site of contact. Nearly all the chemicals can act as irritants, given sufficient exposure to tissue, and cause reversible inflammation, especially eyes, skin, and respiratory passages. Direct contact with chemicals should be therefore avoided as much as possible. Some chemicals determine irreversible effects, frequently by cumulative long-term exposure. Some chemicals can act as sensitizers, causing allergic reactions in a substantial proportion of exposed subjects. Sensitizers' hypersensitivity lasts for life and gets worse with later exposure. It can occur at work because of the high level of exposure. Outside the laboratory, lower concentration of the sensitizer can aggravate the allergy. Formaldehyde is a main example, as its vapor can arise from permanent press clothing, draperies, upholstery, wall coverings, plywood, and many other building materials. Carcinogens are considered to harbor a high risk of causing cancers in humans. Criteria for the carcinogenic designation differ slightly among agencies. Lots of chemicals used in the histopathology departments have a carcinogenic effect, including formaldehyde, chloroform, chromic acid, dioxane, nickel chloride, and potassium dichromate. Also, a number of dyes are carcinogens, like any dye derived from benzidine, including Congo red. There are chemicals targeting specific organs, like xylene, that is neurotoxic. Toxic materials are capable of causing death by ingestion, tissue-skin contact, or inhalation. It is important to know about the chemicals we deal with in our daily work. Packaging is also important and ensure that chemicals are stored and disposed safely. Labels can help you to identify the more hazardous chemicals, tell you what the hazards are, and how to avoid them. Let's get familiar with the symbols of the CLP, Classification, Labeling and Packaging System, internationally adopted since 2010 to label the different chemicals commonly used in our laboratories. Hazard pictograms alert us to the presence of hazardous chemical. The pictograms help us to know that the chemicals we are using might cause harm to people or to the environment. One or more pictograms might appear on the labeling of a single chemical. Some chemicals, like alkaline substances, strong acids, dehydrating and oxidizing agents, can be corrosive. That is, they can damage or destroy living tissues. The image of a liquid damaging a hand indicates the hazard of these substances and the need to wear protective gloves to avoid skin contact. Oxidizers can initiate or promote combustion in other materials and represent a serious fire risk when in contact with suitable substances. Oxidizers include sodium iodate, mercuric oxide, and chromic acid. These chemicals are labeled with the symbol of a flame over a circle. The flame is the symbol for flammable agents. The solvents are flammable, including methyl and ethyl alcohol. The difference between combustibles and flammables is their different flash points. Flash point is the temperature at which vapors will ignite in the presence of an ignition source, and it is not the temperature at which a substance will ignite spontaneously. Combustibles exhibit flash points at or above a certain temperature, commonly 38 degrees centigrade, 100 degrees Fahrenheit. Flammables have flash points below the above-mentioned specific temperature, and they carry higher risk in routine laboratory work compared to combustibles. As I already said, the main concern when storing combustibles and flammables is to make sure that no vapors build up around electrical devices. Explosive chemicals are rare in histology, but a classic example is picric acid. Some silver solutions may become explosive upon aging, and they should never be stored after use. The substances are labeled with the symbol of an exploding bomb. Skull and crossbones is used for chemicals able to determine acute toxicity. Toxins can cause death by ingestion, skin contact, or inhalation at certain concentrations. Some countries use the term poison to designate this category. Such chemicals may interfere with vital cellular processes or damage vital tissues or organs. Concentrations for a toxin that are considered toxic may vary slightly according to the agency making the designation. However, for those used in a lab, methanol is toxic. Chromic acid, osmium tetroxide, and uranyl nitrate are highly toxic. There is an important new symbol indicating substances with serious health hazards, and lots of normally used reagents have acquired this new symbol. A new symbol has been given to the chemicals hazardous to the environment, including a dead tree and fish. An exclamation mark is used to label the substances that are hazardous to the ozone layer or to health. One or more pictograms might appear on the labeling of a single chemical, as in this example, where it's easy to understand that xylene is flammable and carries a serious health hazard. A critical component of control is accurate labeling of materials. Labels should include chemical name and, if a mixture, names of all ingredients, manufacturer's name and address, date purchased or made, expiration date if known, hazard warnings and safety precautions. According to the new classification labeling and packaging of chemicals, in addition to the pictograms, hazard statements should be written on labels like serious eye damage or toxic if swallowed. Precautionary statements should also be written like wear eye protection or do not eat, drink or smoke when using this product. The CLP regulation also introduces two new signal words, danger and warning, to indicate the degree of severity of the hazard of this chemical. In addition, warning signs may be required on the doors of the laboratory or within the laboratory. These may depict the type of hazards or the need to wear a PPE. Other signs may provide reminders of safety protocols and emergency contact information for the institution's safety office in case of emergencies. Even for substances with no known significant hazard, exposure should be minimized. As a matter of fact, health hazards associated with stains and dyes are poorly understood. Most of the dyes have no established permitted exposure limits and can easily become airborne dust. This can be avoided employing safer, ready-to-use, pre-diluted stains. Stains are solutions of dyes in a solvent. Solvents are readily absorbed through the skin and may carry dye molecules with them. The aim of many laboratories today is to eliminate reagents with health hazard pictogram. We can see this pictogram on formalin, xylene, aromatic hydrocarbons, and isoparaffin reagents. There is a new generation of xylene replacement reagents that are less toxic and increase clearing performances with fatty tissue. However, the pictograms help us to understand that, although less toxic to operators' health, they are not totally risk-free. Several countries have established laws for the management and disposal of toxics in order to safeguard the environment. Identifying chemicals that can be disposed of safely in normal trash from other chemicals that must be placed in appropriate containers to be picked up by safety services is important. It is even more important reducing toxics use by substitution and minimization, and possibly recycling through distillation, not only to protect lab workers, but also to reduce the quantity of waste to be hauled away. Unless known otherwise, assume that any mixture would be more toxic than its most toxic component. The permissible exposure limits of the Occupational Safety and Health Administration should be observed. The maximum permissible exposure limits for a substance can vary between countries. A good example is formaldehyde, which is widely used in our laboratories. Formaldehyde, that we use in concentration of 3.7%, is acutely toxic. It can cause skin and respiratory tract irritation and corrosion, skin sensitization. It is genotoxic as well, and it has been recognized as carcinogenic type 1b, in other words, proved carcinogen for humans from January 2016. There was a variety of maximum permitted exposure limits throughout the European countries up to when, in 2019, the European Community decided to state a maximum exposure limit of 0.3 parts per million in case the exposure was lasting 8 hours a day. This limit is doubled to 0.6 parts per million for a short-term exposure. Clearly, there are still places where the maximum permitted exposure limit is well above that agreed between the European countries. For example, in the UK, this limit is 2 parts per million, approximately 7 times greater than the limit stated by the European Community. In Australia, it is 1 part per million, and in the USA, it is 0.75 parts per million. Many countries still haven't got any stated maximum acceptable exposure limit. However, a series of protective measures can be enacted anywhere, including the use of DPE to avoid skin and eye contact, the management of formalin only under filtered fume extractors or on aspirated special benches, monitoring regularly the airborne levels of formalin, buying pre-diluted formalin and pre-filled containers for tissue specimens. A specific training of workers is also very important, as well as the production of written SOPs for formalin storage, spillage and waste. The two fundamental chemical hazards for the histotechnologists are formalin and xylene, both known for their long-term effects. The long-term formalin exposure can lead to eye irritation, tearing, and nasal irritation. Chronic nasal irritation can lead to squamous metaplasia of the nasal respiratory epithelium, and cases of squamous cell carcinoma of the nasal cavity and paranasal sinuses have been linked to the long-term formaldehyde exposure. For xylene, the long-term exposure effects include neurological symptoms like increased anxiety, forgetfulness, and inability to concentrate, and other symptoms such as irritation of the eyes and nose and sore throat. There are a series of measures that should be enacted to prevent incidents with hazardous reagents, including special storage for flammables, the use of PPE and management under fume hoods, appropriate storage of dangerous liquids below countertop height, ingestion, inhalation or absorption of toxic compounds is a potential hazard. There should be no eating, drinking or smoking in the laboratory. Frequent hand washing routinely after removal of gloves is also advised. It is important to establish specific SOPs for each family of hazardous materials on how to handle a spillage or an incident requiring first aid. Clearly, the response to a spillage will depend upon the nature of the hazard, the volume of the spill, and the place where this spill has happened. This is an example of an SOP in case of spillage of formalin, where it is clear that a minor spillage, especially under a chemical fume hood, is managed very differently from a major spillage onto a surface requiring evacuation and adherence to biosafety protocols. But although all the workers in a lab should be fully aware and compliant with the preventive measures and follow the signs and the displayed procedures to avoid incidents, there are special figures in charge of safeguarding others in a laboratory. Let's now hear the words of Vanessa, who is the responsible for health and safety of the histology department at the Royal Marsden Hospital, where we work together.
I'm an advanced practitioner in specimen dissection, but I also have a role of health and safety lead, which I have been doing for 15 years now. It was only supposed to be temporary. The health and safety lead was on maternity leave, and I was asked if I would like to do it. I was quite surprised because I didn't have any training in health and safety apart from modules that you learn at university, and then at work you learn, it's almost like you learn on the job. I went on a course with risk assessment and health and safety. It was an in-house 2-day course, and then at the end you would had questions to answer. Thankfully I passed that. And I've been on various other courses over the last few years. You do top-ups, but really it's a job that you learn as you go along. The Trust has a risk assessment team, so they come in and any issues, specialised issues, it's their job to take care of that. Every month we have a pathology health and safety meeting, which is run by the head of all pathology, and then each department has a health and safety lead, like myself, and we all attend that meeting and we discuss things that have happened in the lab, such as accidents that may have occurred, new legislation, ongoing issues that may be related to the lab but may just be related to the trust in general. I'm more safety aware than before because you are trained and you do know about the role of health and safety in the work that you do. But with my new role as lead, you learn more. As well as being the health and safety lead and specimen practitioner in specimen dissection, I'm also the fire marshal for the department. This was given to me because of my role as the health and safety lead. So I keep up to date with 3 yearly courses with the fire marshal, so learning how to use the fire extinguisher, the different types of extinguishers, what to do if there is a fire. If we have a fire alarm that goes off in the department, it's my role to make sure that the whole department is evacuated, windows and doors are closed, etc. I enjoy what I do, very much so. Dedication as in time, not really. My principal role is specimen dissection. That comes first, and then I'd say about 2 or 3 hours a week that I can dedicate to being the health and safety lead. But I do have help. There is somebody else in the department who we work together. So new equipment that comes in, new reagents and so on. We all work together. We all have a role to play.
These are the basic processes to establish safety. Education. Read web-based information or published national and international guidelines and get to know your institution policies. Get to know the safety personnel and ask whenever you have questions. They are your best ally in keeping your laboratory safe. Speak to them directly and establish regular communications with them, paying attention to their safety memos as regulations may change frequently. SOPs for working with hazards should be designed. SOPs should be reviewed periodically as they may change. The members of the laboratory should support each other regarding safety precautions. On occasion, one might forget to wear a piece of safety equipment such as safety glasses. Gentle reminders to wear appropriate personal protective equipment should always be welcomed as shared concern for each other's safety. The lab personnel are required to undergo safety training, which may be offered as online or in-class training or both. The occupational exposure limits should be monitored by the safety officers periodically in the event that there are spills or unusual fumes noted by laboratory staff. Records should be maintained of safety training as well as of incidents of injury. Typically, once an injury occurs, the injury should be reported to the safety office by the safety personnel. It is important to understand that any accidents are an opportunity to prevent future incidents. Finally, a bit of diversion with another Italian lake that has been chosen to film a recent Netflix series. The emerging tower bell announces that an old village has been submerged. Thank you for listening to me. I'm now open to answer all your questions.